Welcome to the newest episode of the Caucus Corner. Each week, we bring legislators and New Yorkers together to discuss some of the most pressing issues from the perspective of people of color. I am your host, Assemblymember Mikal Salaj, chair of the Black, Puerto Rican, Hispanic, and Asian Legislative Caucus. Our theme this year is a demand for justice, and that message rings clear in the fight to make mental health care more accessible and equitable for every New Yorker. In the past 5 years, a increasing number of New Yorkers have sought professional help for conditions like depression and anxiety. And while this trend suggests that more people are taking their mental health seriously, a significant issue remains. Treatment is more accessible to some communities than others, disproportionately affecting low-income communities and communities of color. So today, in honor of Mental Health Awareness Month, we want to remind all our listeners to prioritize your mental health. And we all need to take steps to break down the stigma surrounding it. We have some wonderful guests on the show today, and I would like to give them a chance to introduce themselves. First, we're going to start off with our guests. We have Luke Sekinyi.
Hi, yes, Luke Sekinyi. I work with the Alliance for Rights and Recovery as the policy director and also a person in mental health recovery myself. Glad to be here with you all.
Glad to be here. And I'm very particular about names. So say your name one more time. Luke Sekinyi.
Yes, Luke Sekinyi.
Well, thank you for being on the show. Next up, I'm going to introduce my great legislative partners. So we have, again, a returning guest here, Senator Summer Brook from the great land of Rochester, right?
Absolutely. So I am Senator Summer Brook. As you said, I am the senator for the city of Rochester and some of the surrounding suburbs here in the 55th Senate District. But I also am the chair of the Senate Mental Health Committee since I came into office in January 2021, and have been really focused on trying to essentially put a spotlight on all of the ways in which the state has been divesting from the mental health sector for the last few decades, and really trying to right some of those wrongs, and also face the fact that we are certainly finding ourselves in a mental health crisis, especially a youth mental health crisis coming out of COVID, and really ensuring that we're building up a sector that can help those who need help the most.
Next, we have the dynamic legislator from Brooklyn. Is Brooklyn in the house, Modi?
Yes. We are here. Here, New York State Assemblymember Monique Chandler Waterman. I am excited about this conversation as we are doing Mental Health Awareness Month. So thank you so much for having me today.
Since the COVID-19 pandemic, studies have shown that 1 in 3 New Yorkers are experiencing one or more mental health conditions. And that number has remained stagnant since 2021. And we know that it disproportionately impacts communities of color. What's going on right now with New York? And, let's level set the listeners. Senator, what are we doing as a state to ensure that people have access to mental health treatment?
Absolutely. And I think, what you said about the COVID-19 pandemic is really true. So when I, came into office, I told folks this is going to be the crisis after the crisis. We are in a mental health crisis. We didn't have the investment and the workforces that folks needed before we hit the COVID-19 pandemic, and that really accelerated a lot of the ways in which we still don't have the workforce that we need. So as far as, legislatively, and of course through the budget process, I've been really focused on 3 things to help address as chair of the Mental Health Committee. One is addressing our workforce, right? We need to recruit and retain not just a diverse workforce, but a robust workforce. Right now, there are young people, there are people with, severe mental illness who are waiting months and even a year to get the care that they need. And so really honing in on how we can support that workforce, whether it's through, we've done scholarships, we've done tuition reimbursements, we have done consecutive cost of living increases for the mental health workforce since 2021. But that was the first time that had happened in over a decade. So there's a lot of ground to make up for. So those are some of the things that we're doing on the workforce side. The other major priority is the solving how we deal with mental health crisis. Right. So unfortunately, when you have a sector that funds have been siphoned away from for decades and where we do not have a robust, diverse workforce, we are going to end up with more individuals facing acute mental health and substance use crises. We know substance misuse and mental health are often co-occurring in individuals. And so while we build up the entire continuum of care, we also need to be very aware that we need to change the way we deal with mental health crisis. So that is why I introduced Daniel's Law in February 2021. Exciting news that Daniel's Law has recently passed the Mental Health Committee. It passed unanimously with bipartisan support. So we are on our way to actually, eventually getting that to the floor and passing statewide Daniel's Law. And in the meantime, we have funded a Daniel's Law task force to study what this is going to look like in New York State. This year, we will be looking to fund Daniel's Law pilot programs in New York State, all along the way of trying to reform how we deal with mental health crisis, right? It is the only medical crisis that you will face where your only choice is an armed law enforcement officer. And we know that's not the right choice. Law enforcement knows that's not the right choice. They are asking us to come up with alternatives. They know this is not what they go to police academy for. And so, when you look at the numbers, and again, these numbers are people's lives. When you have a mental health diagnosis, you're 16 times more likely to be a part of police violence, and we've talked to our law enforcement. They don't feel they have the training necessary for these things, and so often those either with diagnosed or undiagnosed mental illness are bearing the brunt of violence, right? They are the victims. And I think that we need to do a lot more. And that's part of public safety, is making sure that folks are safe and that we have the right responders showing up. So by having peers, by having crisis counselors, by having mental health providers, substance use counselors showing up when someone is in that crisis mode, they're able to de-escalate, they're able to pair them with the right services. And oftentimes you see much more positive results. And this is, just so folks know, Daniel's Law is based on programs that have existed for decades in other parts of the country. In Eugene, Oregon, they've had the Cahoots program for over 20, 30 years. Denver has a similar program. Programs like this are popping up in North Carolina. So we are certainly not the first, but we would be the first to have a statewide framework for this type of public health response to mental health crisis. And every day that we don't do it, we're putting people in danger. And so that's why we've been focused on doing that.
And Luke, being on the ground as Director of Public Policy Engagement at the Alliance for Rights and Recoveries, what are you seeing and how can you level set the listeners on what's the status of New York State?
Yeah, thank you. I think Senator Brute put it perfectly here. At our organization, we are a member-based group that really works with people who use and or provide services. And that allows us to see not only what is going on the recipient end of services, but also from the provider side. And what we saw during COVID was this need to increase services because of the increased demand due to a lot of people seeing isolation and ending up to have more acute symptoms and more acute mental health issues. But we also were seeing a workforce exodus due to the fact that this is a really difficult job oftentimes. And, this is a group of folks who do this more for compassion than anything else. But what we had really experienced was this lack of investment over the last 2 decades really come to a head as it hit the COVID pandemic. So we saw a lot of people leaving the workforce as we had this increased demand for services. So what I will say is I'm incredibly grateful to the legislature and governor over the last 2 years for putting in so much funding into mental health services and supports for people who are dealing with mental health challenges. But we know that this is really just the first step to clawing ourselves back from this crisis. So things that we really need are more community-based services to, one, prevent people from having those acute symptoms, and then services to help support people as they leave acute settings like hospitals or stabilization centers. And as Senator Brooke posited here, really focusing in on crisis services, because this is one area where many people don't enter the mental health service continuum until they've hit a crisis point. And that's something that we really need to change and really offer preventative services early on, like with youth, and having peer-to-peer services for youth to help each other, as well as us offer more services and more ability for youth to talk about the challenges that they're experiencing in a constructive way, so that we are able to not only hear what they're going through, but also offer them strategies to mitigate some of the issues that they're seeing. And then lastly, I really want to focus in on one thing that kind of hits the head on a lot of the issues that we're seeing, and that is housing. You know, we can't have adequate mental health services, adequate ability to enter recovery if you are struggling to find housing. And all of these issues between COVID, housing, and the lack of funding have really come together to create this crisis that we're seeing. So we are incredibly grateful to the legislature, and specifically Senator Brooke, around the introduction of Daniel's Law and looking to fund Daniel's Law pilots this year, so that we can offer people crisis services that are appropriate and health focused, instead of being punitive or thinking about it from a public safety only measure. And, you know, the thing that we also know is a healthy community also allows for a more safe community. When people aren't worried about how they're going to get the services that they need, they're more likely to be engaged in things like working and supporting their community members and offering peer services. So these are some of the areas that we really need to touch on, but we also need to focus on those reentry services to get people back in the community, whether they're leaving a hospital or other institutions like jails and prisons. And then also really focusing on that preventive factor to stop the pipeline of people going into these more acute situations that are often very traumatizing and can cause large disruptions in people's lives that are hard to recover from.
And Assemblywoman, you know, I've known that you've been very active on the mental health space. And, you know, Luke talked about what's happening on the ground. But, you know, as a member of the Brooklyn delegation and being in New York City, you know, we see these horror stories of people having mental health crises on the street. You know, for you, this is, you know, you take this to heart. You know, what are you doing, and why is this topic so special to you?
Well, thank you so much, Chair Solanges. Since taking office, I started something called the 8058 Mental Health Task Force, people with lived experiences, peer advocates, those in our community. And that started from about, say, I have over 30-year journey with family members who are living with mental health conditions. And we didn't know what that looked like. I come from a Caribbean background, mostly Black and Brown community. We didn't know the support. We didn't know the signs. We didn't know how to help. So we created a task force, because I know that in my district is predominantly Black and Brown Caribbeans. It's not talked about. So we need to destigmatize and decriminalize, but we need to do it in a holistic way. And the task force help with prevention, intervention, restoration, legislation. So what does that mean? Making sure we come up with legislation from my community members. As I represent in the state, I need to make sure within my district, those voices are brought through our priorities when it comes to the budget items, making sure that there's money and resources coming to communities. And I believe every community should be able to shape what that look like for them and be a part of those closer to the problems, closer to the solution. So we always believe that peer advocates, those peer specialists, have to be in every conversation. We need to make sure we have culturally sensitive respite centers, local clubhouses, and making sure that we have a non-police response when it comes to those having a mental health crisis, and making sure that we provide more intentional person-centered resources in our community.
And I love how you're really integrating your local community in this process, because we all know that government is a participation sport.
Yes.
And so, you know, a study that was done in the last November showed that, the staff to patient ratio in mental health clinics have fallen, and the amount of patients in clinics are now rising and staff is declining. So like, what can we do? Like, what as a state can we do to make sure that we're at least, building a foundation and solidifying the mental health, provider space? And that's for
Well, we
anyone,
have Well, we successfully passed, thank you to colleagues in the group, Daniel's Law. But we have a task force that was passed, and we need to make sure we pass that full law, because what it would do is you get the perspectives of what is needed, because beds is not just the answer by itself, right? There's a holistic approach, it's multifaceted, and we need to get that from the community members. So investments need to be more prevention, right? Making sure people have, like I said, those respite centers. They have clubhouses, right? We start younger in schools. There's mental health clinics, expanding that, making sure that the trauma that we endure and the things that leads to triggering a mental health condition, that we are dealing with the social determinants of health. So there is a multi-layer issue, and it's not just beds. But we need to also, when it comes to beds, incentivize staff, because people are not getting paid, or they're not getting the thanks or the gratitude. We need to make sure that they're able to go to school for free. We have to find a way to have a balance, and making sure that they're able to be, health providers are able to be safe in the space, and then that the clients, the community members also feel safe. So we need to make sure we have the peer advocates at the table. We passed Daniel's Law completely to make sure that we're really looking at the holistic approach, and it's not just beds is the answer. It's more than that.
Yeah, I would also agree here. I think two things are critical. One is paying our workforce the adequate wages to keep them in the workforce and to help them grow within it, so that they really make a career out of this. What we've been seeing is a lot of people leave the workforce for other jobs that are right now paying just above minimum wage, but that is often even more than what we are able to pay from the nonprofit sector, which covers most of the services for mental health and substance use challenges. The other thing is really encouraging youth to get into this field earlier. So making sure that, one, people look at the mental health service field as something that is prestigious and work that people want to be able to do and want to be able to tell their friends that they're doing, and making sure that we ease the opportunities to get into this workforce, and really look at other, we often talk about the clinical workforce and often forget that that encompasses more than just doctors and nurses, but also community health workers and peers specialists, and being able to elevate those positions so that they get the respect needed, as well as the compensation needed, so that they can not only provide these critical services to support their fellow New Yorkers, but also be able to support themselves and feed their families and not worry about where they're going to get their next meal, and whether or not they need to get on food stamps, like 20% of our workforce currently is, especially when you consider the fact that for the mental health service field, especially the community-based services, the majority of our workforce are people of color and women. And the fact that we are neglecting to offer adequate compensation for the incredible work they do day in, day out is really just another way that we keep these communities down, and we underinvest in these communities and the people trying to support those communities.
I'll just add too, because I think all of these points are so incredibly valid, and I want to put an exclamation point so folks hear that again, what Luke just said. 20%, he said, of the workforce are currently on some sort of assistance or food stamps. So if we just think about that, right? Think about being a parent and your child needs help. They're struggling. They need help from a mental health provider, right? And again, these providers are not all doctors, as Luke said as well. These are social workers, these are counselors, these are peers, these are community health workers at whatever agency you go to. And the person who's providing you that care is someone who is barely able to support their family through that job. And I think that when we think of it like that, it makes it a little bit more real and more visceral for why it's so important that we are investing in a workforce. Wouldn't you say that you want the best care for your child? Wouldn't you want the person who's caring for you, your loved one, your friend, your family member, or yourself to be fully focused on that work, to be able to be fully focused on that work, not worrying about their second, third job, right? These are qualified professionals that we have systematically and historically undervalued. And so when you have that undervaluing, how then in the same breath can we go out and try to recruit all these new folks into this field when the state and so much of this sector, has shown the undervalue for mental health workers? And so, I think a lot of times we have these conversations in Albany and we're fighting for COLAs and we're fighting for workforce, but sometimes you have to go back to what that feels like to walk in the door of the place that you're seeking help. You want to feel safe. You want to feel like the care, you can depend on that care. You want to make sure someone's there to open the door, someone's behind that desk, someone's there to give you the care you need. And right now, there are so many New Yorkers who do not have that. And there are so many New Yorkers who are in those agencies who are going to open that door for you, but they are worried about taking care of their own families. And that's not any way to live. And that's why we see so many people leaving. The other thing I wanted to add too is as we're talking about workforce and making sure that we have the folks in these positions, when we talk about cultural competency, linguistic competency, it's not just that it's not just that, if as a Black woman, I want a Black therapist or a woman therapist. It's not just that, right? It's not just sharing identities. It's literally sharing culture, sharing space, and sharing community. And so specifically peer advocates, I think, create that they're a really important tool as a part of the mental health sector, because these are individuals who have been through similar things in similar places, right? They understand when you're making references to your community, you might be, going to the same grocery stores, having gone to some of the same schools, and they're right there. And they actually are more dependable because they are right there in your communities, right? They're not, flying in, driving in from far away. They're a part of that neighborhood and that community fabric. And I can't overstate how crucial that is when you're seeking care, to feel like the person sees you, hears you, understands you, because building that trust also encourages you to continue on your path of whether it's treatment or going to counseling, right? So I think these are words that we use a lot, and I always want to step back to make it a little bit more realistic as to what it is we're trying to create. And all of the things we're talking about workforce, we have to, in the same breath, always talk about diversifying it and grounding it in our communities and creating more pathways, as was talked about, more pathways for people who are even younger to feel pride in following one of these career paths.
And I love how you put it, like grounding it in our communities. And I know several of you have mentioned this, that there's a stigma, especially in communities of color, around mental health treatment. We've seen time and time again when people are going through this, people don't want to talk about it or disclose it. What can we do as a community to get New Yorkers involved involved in challenging the stigma around mental health?
I'll jump in real quick. Just make it an everyday language. Like today, you're about to go to Link NYC, a partnership. There's a 9A button there, and just having general conversations with our community members outside of public health education, and just making sure that we model that behavior in the workplace, in different ways. It could just be a more organic approach, and just definitely making it a part of our everyday life. So much in our community, people are coming and just having regular we do it in the barbershops, we do it in the beauty salons, we are doing it in many different spaces. So we just want to make sure that we bring those programs in, we talk about it in the schools, but then we make it we remove the taboo of talking about that in agencies, NYPD, all these different places that we know that it could be more intentional in the churches. I make announcements in churches, and I go and talk about 9A and the support and other ways that we could get support. Because a lot of people in our community, we utilize clergy, we utilize the grocery store, the bodega, we utilize all these space as our social worker or our counselor. So just making sure that we are having those intentional conversations and talking through and saying it's okay not to be okay. That's one of the things that I would say is a way.
Yeah, I can't I can't stress enough how important that is. I think the utilization of the community to really push back against the stigma and considering or thinking about it not in the more formal ways of talking about mental health, but really just the everyday, as Assemblywoman Chandler Waterman was just saying, thinking about the faith-based community, the barbershops, these places that people already are going to, and trusted members of the community, talking to people in a way that's comfortable for them, in a way that resonates with them, not just telling people you need to have a diagnosis or XYZ, that you need to go seek therapy right away, but really just being able to talk and consider the way that people are feeling, and being open to hearing negative feelings sometimes, but also just being able to share experiences, that things that you yourself have gone through. That is really what is at the heart of peer support. It's that shared connection and being willing and open to telling people about your own experience. Part of the reason I always start many of my conversations and speeches around mental health by talking about the fact that I'm in recovery myself is to remind people that this is what recovery looks like as well. That you can have, you can be in these positions speaking with legislators and going to school and everything else that everybody else does, and still be in recovery, so that we reduce that stigma about what recovery looks like in the first place.
I think that's such a good point. And I agree with everything that was said. And I want to add maybe a point of data to underscore it. Luke just talked about, it doesn't always have to be, I'm going through something really difficult, or, I have a diagnosis. I mean, part of mental health is also just that more casual sharing, right? And so it reminds me of, I recently visited the 988 call center here in Monroe County, and learned that 98% of, the calls coming in to 988 are actually resolved right on the phone. That means that someone, needed to talk through something, they needed to be guided through that conversation, and they were okay in that moment, right? There didn't need to be first responders, nothing like that. And so when you think about that, and you hear this from all sorts of programs that either do text-based or call-based mental health or substance use, supports, is that talking through things to avoid getting to that, really difficult crisis moment is so necessary. And so, I think that is exactly what needs to happen in more communities, right? Is the check-ins, right? And it's not always when everything's, falling apart and feeling overwhelming. Sometimes it's, a few steps before that. But the ability to talk through those things can really help prevent those moments, right? And so I think that is what all of us can do. All of us can do that, and you don't need to come to a hearing and share, your entire story to compel, legislators to write a law. That's a big step for someone. You can just share parts of your story with someone close to you, right? You can reach out to those already in your circle, and just through your actions, destigmatize the idea of talking about mental health and normalize it.
And with all that's going on in the world, it's okay to seek help, because, we are going through, unprecedented times, and we're here for each other. So, with that, any last words, any last, bits of knowledge you'd like to tell the listeners, and that's open to anyone.
I think the one thing I always like to stress to people is just get involved. I think, we talk about the need to uplift our communities, but that really starts with our community members. And one of the beauties of my own position and my job is I get to meet with a lot of legislators like yourselves here, and recognize how much you all care and how much you all want to learn from the communities. So my biggest push to everyone is to get involved in advocacy, get involved by reaching out to your local leaders, organizing your community in any way that you can. It does seem daunting at first, but oftentimes once you make a couple of connections, you really get to snowball this effect of advocacy and that community representation, and know that nothing really changes without us being at that table and calling for those needed changes, and letting our legislators and other local leaders know what we need so that they can help facilitate that. I think it's been phenomenal to see both Senator Brooke and Assemblymember Chandler Waterman and the way that they have been working within their communities to not just listen to the community, but also provide some support directly to that community with especially around Daniel's Law and crisis response from Senator Brooke, and then the mental health group that the mental health task force, yes, thank you, that Monique Chandler Waterman has been able to put on, and looking at the conversations that have been going on. And I know there's something coming out this weekend as well, but just constantly looking to see how the community can improve and what the community needs. I think if we take that step, it also allows our legislators to have more understanding of what we need and understanding of where we need to go.
My last thoughts would be to reiterate to anyone listening just the fact that I do believe we have several leaders in positions, as policymakers, as leaders of organizations who truly do, or at least are starting to understand some of the mental health challenges and needs that we have in this state, and that we really do want to hear from you. And we don't take that lightly. Every time someone shares their story with me, I carry that story with me. And that story informs the work that I do to make sure that it's actually going to help the folks that need it. I would also say in the last few years, New York has done a lot on trying to rebuild our mental health sector. We have one of the strongest 988 systems in the country. And so if you are someone who is looking for help, I encourage you, you can go on the web, you can call, or you can text 988 to try to get some of that help as well.
And I would add that you could also go to, if you're in the city, your nearest Link kiosk. The number is also on that, a Link NYC kiosk that you normally charge your phone. There's a lot of wraparound services that you can also get from there. And I would just say for my final thoughts in general is that there is hope. There is hope. And sometimes when we feel there's no hope, and that's where I will say our biggest problem will lie. But as long as we continue understanding, feeling, believing that there's hope, you are heard, you are seen. We did a lot of big steps in the state to make sure that we address some of the inequalities or inequities. And guess what? We still have a long way to go. So we need your voices. We need your advocacy. We need you to be in the space to constantly, like the senator say, your stories stay with us. Your stories are in our families. Our family members are also, we are at times having mental health conditions. And I think anything, it doesn't always have to be a condition, but anything left untreated becomes more of a condition. So we just want to make sure that those voices are edified, so that this way we can have it organically through legislation and through funding as well. But we all need it. I always say this is not an I thing, this is a we thing. We all got to do this. It's a shared responsibility, and everybody is needed at the table, because everyone has a different perspectives. But first and foremost, we need peer advocates, peer specialists who have lived experience and lived expertise to be a part of the solution as they are closer to the problem. So thank you so much for this conversation. It's very needed. And just make sure that if you feel overwhelmed or you need some support, call 988 or call a mental health provider that can support you through the rough time.
And that's an excellent place to end our conversation. Thank you to our guests. Assemblymember Senator Luke, you were amazing and really bringing hope to our New Yorker. So to our listeners, thank you so much for tuning in to this latest episode of Caucus Corner. Once again, you can follow us on all social media platforms at BPHA Caucus. You like, subscribe, and we'll see you next week. Thank you.